Goni skill, hip abduction. Assist the patient to the supine position. Make sure the knees are extended and both hips are in a neutral position. In patient-appropriate language, ask the patient to abduct the hip while you assess the pelvis with one hand for lateral tilting or rotation. Watch the trunk for lateral flexion. Support the lower extremity around the calcaneus and passively abduct the hip to end range, making sure not to allow external rotation or flexion of the hip. As you stabilize the pelvis to prevent lateral tilt or rotation of the pelvis, the end of range of motion occurs when resistance to further motion of the femur is felt, and the attempts to overcome the resistance causes lateral pelvic tilting, pelvic rotation, or lateral flexion of the trunk. Assess the end feel of the joint, which should be firm because of the tension in the inferior joint capsule, pubofemoral ligament, ischiofemoral ligament, and inferior band of the iliofemoral ligament. Passive tension in the adductor magnus, adductor longus, adductor brevis, pectineus, and gracilis muscles may contribute to the firm end feel. You are now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. Align the axis of the goniometer over the anterior superior iliac spine of the extremity being measured. Align the stationary arm with an imaginary horizontal line extending from one ASIS to the other. Align the movable arm with the anterior midline of the femur using the midline of the patella for reference. Ask the patient to perform hip abduction as previously, maintaining the goniometer in alignment through the entire range of motion and observing the pelvis for any extraneous movements. Read the degrees of motion on the goniometer and then ask the patient to return the leg to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. If necessary, assist the patient back to the sitting position. Average range of motion, according to the American Association of Orthopedic Surgeons, is 45 degrees.